My name is Sandy Racco. I'm from Canada. I've been living in Australia the last 9 years. About 6 months ago now, I went for my routine pap smear and an HPV test, and it came back abnormal, and I tested positive for HPV. So that was scary to hear that. The next step was to go and get a colposcopy at a specialist. It revealed that I had SIN3, severe SIN3, which is precancerous cells. I was then referred to another specialist who specializes in oncology, a gynecologic oncologist. So the next step was a cone biopsy. I got the results, and I was very early stage 1A1. Had a very, very small tumor. The margins were clear, although the doctor said because I've already had my children, I'm a little bit older, it would probably be safer for me to get a hysterectomy. In Australia, where I live in Perth, they advised me to have a radical hysterectomy and full pelvic node removal. And they wanted me to have it done abdominally, not laparoscopically, not minimally invasive. I had already done some research. I had already learned about minimally invasive surgery for cervical cancer. There were trials done, specifically the LACC trial, LACC trial. And I wanted to find out more, and I did question my doctor about it. But he said that the risk factors coming in with the LACC trial that were discussed there of more recurrence and ultimate death in women. So when I was doing my research, I came across a YouTube video by Dr. Lucas Menig, which he did in English, which is wonderful. It was very easy for me to understand what he was saying, and I thought, I need to speak with this doctor. I think he'll be able to help me make a decision of which way to go. So I contacted the email address on the website, his website, and we arranged a video conference call, and it went very well. He explained everything to me in detail, all the questions I had, he was able to answer, and I had many questions after that as well, which I sent many emails with questions, and he was always very happy to answer them for me. I think I even had several more conference calls after that, maybe 2 or 3. And I apologized for all the questions, but he was very, very kind and willing to answer everything, because he knew how important it was for me to have the right answers. Because my family is from Toronto, I decided to make contact with some doctors in Toronto, Canada as well, to get their opinion. And this is very important when you're going through something like this, is getting second, third, fourth opinions. Do it. Because there is not only one way to do something. But by doing this, I was able to dealt with the head of surgery at Princess Margaret Hospital in Toronto and the head of surgery at Sunnybrook Hospital in Toronto. And their advice for me was very similar to Dr. Menig's. So now I had to decide who was I going to go with. And I wanted to get this done as soon as possible, because obviously it's cancer and you don't want to wait too long. You don't want it to spread. But also I went with the doctor who I felt the most comfortable with. So I came to Valencia, Spain for my procedure, and I never thought I would ever do something like that. But when you're going through a health issue, you have to look at all your options. And for me, this was the best option, and I'm very, very happy that I did it. I had my procedure just over a week ago, laparoscopic hysterectomy, sentinel node biopsy. My biopsy came back clear. I don't have any cancer in the cervix. I'm shocked that after one day, or really the same day, that I can get up out of bed and walk and go to the washroom by myself and have a shower by myself and do all the normal things. I came to a different country, and have been able to walk through the city and do shopping and go to restaurants and climb a castle within a few days of my surgery. Probably did a little bit too much, but I was able to do it. And so it's really a miracle that you're able to get this type of surgery with those type of results. My recommendation for women going through this type of situation: don't be afraid to get a second opinion and a third or a fourth opinion. The doctors where you live may not have all the answers for you. They might not have the best procedure offered to you, as it wasn't to me. Seek out doctors in areas of the world where they are more advanced, where they have more experience, and they have done this type of procedure more often. And you will likely come across doctors like I have who are able to perform it in a less invasive way with quicker recovery. You'll be on your feet the next day instead of weeks later if it's not necessary, of course. If you're told that you might have cancer, or if you're told that you do have cancer, it doesn't mean that necessarily you're going to die, okay? There's so many treatments available now, and we've come so far, you know, in this world to take care of these things. And it was a shock for me, and as it would be for most women, but you'll be okay. You find a good doctor, and they'll take you through the steps, and it'll be okay.